It is Monday, September 16th, right around the 5 o'clock hour, and we are going to start our meeting of the Kingston Board of Health. Looks like we passed around the bills. We also have 2 sets of meeting minutes to review. I'm not sure if everybody checked their email or if they did time now. But is that the variance that's coming across?
Yes.
Are we anticipating anybody joining?
No, his dad passed away.
Oh, yeah.
Yeah, so I'm like, dude, I got this. or
Our
something.
condolences.
Yeah, I already talked to Joe about it. Joe knows, knew that McHugh wasn't gonna be able to be here.
Yeah.
And it's pretty straightforward. It's not anything we haven't done.
Hmm.
Was it just? That was just part of the email, wasn't it?
No, I was talking about it.
So the variance. Some, yeah.
Oh, apparently
Move to
some
approve the
idiot.
meeting minutes of August 19th. I can't vote on it. I can read it.
You can move it.
Second that.
Any discussion? All in favor?
No.
Aye.
President not voting. Move to approve the minutes of August 29th.
Second.
Any discussion? You still reading them, Bill? Are you still reading the minutes from the 29th? Or are you good with them?
I'm good with them. I'm just looking over the whole thing.
Yeah, no worries.
It's gotta be second.
It was seconded.
Oh, I thought so. Yeah.
I was just letting you finish looking at them.
Well, I'm looking at everything.
Okay.
Yeah.
All in agreement?
Aye.
President not voting.
You didn't come to that one either.
Nope. I missed those votes.
Well, goodness, Dennis.
I used to have a
Welcome.
sterling attendance record.
Okay, then it looks like we move on to the 5 Cooper's Run variance request.
Yeah.
My understanding is that this is a well for irrigation
Only.
or irrigation only. Okay.
Yep, and the issue is that we don't technically have what would normally be required between the SAS and the boundary. And so by moving it 15 feet off the boundary and 80 feet from the SAS will allow them, given the topography of the lot, there really isn't any other option, unfortunately. I know, I did have a discussion with Joe about it before he left. And as you can see, it's an odd shaped lot. We can't really put it down here due to elevation. And so it's looking to go somewhere over in here. He's got it marked off on his, I just don't have the map that he marked off. He was gonna come and then his father unexpectedly passed away and they are having the wake tonight. And so I discussed it with Joe. I don't have any problem moving it, you know, giving the variance for the alteration of feet requirement because it's an irrigation well, it should not be an issue. So it would be instead of the 20 feet, it would be 15, and instead of he's supposed to have 125 total. So by reducing it down to 85, it puts it, gives some buffer along this, and it leaves it in an area where the elevation is still high enough that there's no issue. That's how it was explained to me, and Joe seemed to be on board with it, so. You have the variance in your packet.
No, I don't.
Oh, no, you have the, oh, never mind, I'm sorry, I have it right in front of me. Anybody want to look at these plans?
Anybody want to make a motion so we can talk about it?
Move to approve the variance for, 5 Cooper Run for a well.
Just want to make sure everybody's clear. It's an irrigation well only. It's not
Irrigation
for
well.
potable water.
Yeah. Southwest corner.
We have somebody for that one.
I'll second it. Yeah.
Okay,
It's
Bill,
going down.
okay.
It's
I think I would,
perfect.
I would be okay with it as long as it is very clearly marked that it is not potable water, it's
Yep.
for irrigation only.
Yeah, that's not an issue. Let John McHugh know that it has to be noted somewhere on it that it's for irrigation only. I'm pretty sure nobody's gonna be using it for anything otherwise, but I'll have him note that.
You never know, so.
Yes.
Let's just keep people safe.
Yep,
You
one does never know.
never know what could
Yeah.
happen. Okay,
And I know that, just as an aside note to this, I know that, Joe had asked me to get in touch with some drillers to kind of go over, because we do need to look at these, drilling regulations in the future to make them more current, to what's actually industry standard now versus when these were written.
sounds good. All in favor?
Aye.
Aye.
Moving on to our health agents.
Which I do not have in the folder. I was off Thursday and Friday, and I was in Surf Safe all day, and
It's okay. How are things
Sorry.
going, Joyce?
so I've done, I think, 3 perk tests since our last meeting on whatever that was, the 29th, or emergency, or the last actual real board meeting, not the,
Scheduled.
yeah.
Non-emergency.
Yeah, I've done, I think it's 3 perk tests. I participated in the CHA survey for BID that looked at what the needs possibly could be for the town. So I did express food insecurity, isolation, especially in the elderly population, the usual suspects for health of kids and that kind of thing. So it's just basically they just gather information, and this study won't be done for, I think she said, 9 months. So
Is that the one that we posted online everywhere?
no, this is through BID.
This was a BID one.
maybe
It was
we
a
did-
survey posted online.
That could have been it.
We put the feed on the Facebook.
And then, we still have 2 active housing issues. 273 is still a work in progress. And then I have another one at another location that is really more about just working with the people to get on a schedule to sort of, work with getting things in a more appropriate condition.
Is that the one down in the Nook?
No,
No?
completely separate thing. This is
Okay.
on a different location, and there's some other surrounding issues
Okay.
that are, it's just a challenge, and so it seemed like a better course of action to work with the family to get things sort of on the right track than initially just issue an order, which could have the potential ramifications of making them not be able to live there anymore. And so we're doing basically 4 days now we're up to a week, so I'm checking in with them. And the idea is, as long as there's progress being made, then we will work with that, and if progress is not made, then a correction order will issue.
Okay.
So that's where we're at with that. I went to the tobacco court hearing. Oh, yeah, it was a whole thing. So apparently, they expressed to the court that they no longer speak English. So now we have been rescheduled to, have a hearing with an interpreter present.
Okay.
And then on the same note, that same business owner is now looking to open another business. So, once that, I'm just putting everybody on notice, once that issue comes to light and all paperwork is put in, I will be bringing it to the board for recommendations. Because at this time, we have 3 current businesses that we license, and we have had compliance issues with all 3. I'm not clear on how the board would like to proceed with opening another 4th.
Well, then we can have a great discussion when that comes to fruition.
Yes, we had a grant meeting. Nothing big to report there, except as you can see from, I believe you all got a copy of Janet's Healthy Kingston information. I did address with the grant that I was not okay with one person making a decision for the grant, and that the topic of us appearing, or any member of the grant appearing on Healthy Kingston, should have been brought to the committee and not dictated by one person, and that I found the email to Janet to be both harsh and unwarranted. And that the whole idea behind appearing on Healthy Kingston was to promote what we do. And that it's not just people from Kingston that may watch that program. It's on cable access channel, which everybody in the area, to my understanding,
It's on YouTube.
has access to.
Yeah.
So that was a big portion of the discussion in the grant. So at this point, I believe that Janet's just said, she's gonna go in a different direction, but I was not the only person that felt that way at the grant committee meeting. That was just not okay for, we should have had a discussion about it, so.
And
There is a chance that, in the future, that maybe we will, be,
be able to have that.
Appearing on it.
epidemiologist.
yeah. So, that's pretty much it. We're not very active. We have perks, we have septic repairs. Child's Drive is moving forward. I've done a couple, inspections. They have 2 new ones going in. I think they're just preparing, getting stuff ready. I don't think the houses have sold yet. I am in communication with the planning department because they also have, I'm gonna call it the wrong thing, but like affordable housing units in there. And so part of the agreement is that certain percentages of things can be sold, and then it has to be these affordable housing units before other things can go forward. So I just touched base with that. I am attempting to reapply for the septic betterment loan. Who did that in the past? Does anybody know?
Joe's gonna know most of the information on that.
Okay, so I'll get in touch with him and he's back.
Yeah.
But I am trying, because that needs to go on the town warrant for the fall. It's not gonna cost anybody anything, but it has to be voted on by the community to accept that they want to be part of the betterment loan, is my understanding.
If you want to look into it further before Joe gets back,
Yeah,
you could reach out to Arthur.
okay, yeah,
Arthur will have some.
knowledge. I mean, I understand that it's the getting on the portal to apply for it is the real issue that I need to navigate,
Okay.
is the actual getting the application in, putting all the information in, so. I'll reach out
When
to
was the last
Arthur.
time we applied for it? Do you know? the
I think
answer
it
to
was
that?
at least 4 years ago, so that's my thing. It could have been any of the other previous people that were here. Marcia
Is-
or
Or is Kathy still in the upstairs office?
Kathleen?
Yeah.
Yeah, I can talk to her.
Ask her.
All right.
I'm just trying to think of some other reasons.
Who else was, around?
Exactly.
So, working on getting that done. I just taught a Surf Safe class. This is like the 2nd or 3rd time in 20 years. My exams didn't come, so we completed the class, and I just told people as soon as I booked more ones, as soon as I get them, I will contact everybody and make arrangements to provide the exam to it was 8 people, so and 2 of them are husband and wife, and people have flexibility, so we'll get them taken care of, but that's good that we're at least generating
We still have continued interest.
yeah,
in that. That's great.
reasonable interest. I probably won't do another one until after the first of the year.
Mhm.
It will be a good time because most restaurants and hospitality slows down right after the new year, so it's a good time for people to use that downtime to
Pull
up
the
their,
staff.
up their certificates.
Yeah, I think by doing it on Mondays is really wise too, because a lot
I'm
of people are
trying.
closed on Mondays. I know
Exactly,
that's a
yeah.
big project for you.
But I think, I'll hold off until, after the first of the year, see the, I don't think that running it between now and Christmas is gonna be very fruitful. It's tends to be a busy time of year for people. That's about it that I can think of.
Are we done with beach water testing?
Hallelujah, yes. So I am now waiting for invoices from them to get that all settled.
Yeah.
And to be able to bill the beach association. I think they had 1 or 2 testings, so they'll have to pay for that. And that was explained to them. They're aware of it. And the guys I'm dealing with are very helpful and very cooperative. So
How are we
yeah, it
doing?
went smoothly.
AAA.
We're still moderate risk for both. West Nile virus, neither has increased. As you notice, the temperature has been getting lower at night, so hopefully that's gonna help to suppress, we won't get a spike, hopefully. I'm praying for the first frost.
We extend, the extended dry spell is gonna also be helping.
Yeah. Well, we'll see what happens after Wednesday, Thursday.
Is that about all you have?
Yeah,
Okay.
that's it. I've got
that's a
no,
Good
no.
segue into our next thing.
But I just want to let you know that I've got no new applications for the nursing position.
I figured,
Yeah,
because
I
you
just,
hadn't let me know, so.
yeah, I wanted to just put it on record. I am trying.
Okay. So Joe has asked that we hold off on voting on this discussion number 1 until he is back. But I brought up to Joe that I felt the health agent covered under the roles and responsibilities in the emergency situations, things like a high risk of EEE or West Nile or Lyme's disease should give the health agent the
Already.
authority to enact things such as spraying or field closing at dusk or,
Yeah, without having. a
without
meeting.
having to call emergency
Sure.
meetings.
Well, if it's done as an emergency, I would say, to encumber that action with a meeting is counterproductive and sort of counterintuitive.
Yeah,
If we give her, and I think we should, give the health agent authority to enact an emergency situation in regard to EEE or something like that, if we have
a
that.
health emergency.
A health emergency, and then the board simply ratifies it, and if for some reason we think that she's exceeded her authority, we rescind it, but at the same time, you do not handicap the person in the field
Exactly.
with
Um,
bureaucracy.
So that is just planting a little seed for everybody to ruminate on until. You like that word? Rumination. Ruminate on until our next meeting.
Not spell it.
ATIO.
We have review of the residential kitchen guidelines.
Okay, so, I would like for the board to really take a look at what you're authorizing and what you want to require as components that must be present to approve a residential kitchen.
So Joyce, may I ask of you, could you possibly put together what you think is an appropriate guideline and email it all to us?
Yeah.
We will discuss this also at our next meeting.
Yeah, this was just to sort of get you guys to think about it, and I'm big on the FDA retail grant standards. I think it's, that's what we're all moving towards as a way to inspect and to work at keeping food safe. So I think a lot of the components, there's somebody I had come in was telling me that they're trying to make it so that there's no regulation around residential kitchens, that basically you can do whatever you want through the Senate and the legislature. And that basically we would not be involved in permitting. Now, this is the information I got. It doesn't make it 100%
Very much
accurate,
hearsay.
but that my concern is if that were to happen, we need to have stuff in place, because what they're saying is that, you just have to put, this is made in a non-inspected kitchen. So it does leave the gates wide open. I am not saying one way or another what needs to be done. I'm just bringing it to the board's attention.
No, you definitely have
The qualifications.
the qualifications and more food safety knowledge than myself.
That's right.
I will not blanket that to the board. So your recommendations would be greatly appreciated for us to take a peek at.
Okay.
The residential kitchen is,
So if you were to make lasagna at your house and then have somebody pay you $15 for your lasagna,
You can't make that in residential.
right now you can't. But what Joyce is saying is there may be some legislation coming up that changes that to just say a non-inspected kitchen.
because I know that, it's fundraisers, stuff like that, sometimes they have,
No, that's a different issue, Dennis.
okay.
This is,
Yeah, that's
this is,
completely separate.
this is, you know, your
Well,
next door neighbor.
I didn't finish, so I'm not sure how it's separate. For example, people will make, chocolate or fudge or brownies and sell them. Or donate them for sale. That's, would the residential kitchen requirements hit that?
So that's what we're gonna talk about.
Okay.
But she's just saying this is gonna be coming down the pipeline and we need to have discussions about it. We all need to do our research and come back with the knowledge so that we can make a educated discussion and decision.
In what you're talking about, Dennis, we did sort of address that. I think it was last fall or last winter. That like when you're talking about the church fairs and they're making stuff to sell at like a bazaar, a church bazaar, that they have to have just the ingredients and it has to say not made in a certified kitchen, but that's really more for you want to support your
Consumer
church, so you make a loaf of blueberry bread and somebody gives a donation to the church of $5 for your loaf. What we're talking about is somebody who's using this as a income generator and they are selling either at like farmers markets or they are selling at craft fairs or events where they are selling to the general public. And most people would assume that those foods would be being produced in a commissary kitchen or a certified kitchen where there's some oversight. So it's a little, what you're talking about, we did come up with a plan for that
For the big
already.
sales and things.
Yeah, that doesn't get included in this. This is somebody that's using it
You're
as a
doing it
business
as a
model.
commercial venture, this is an income stream.
Yes, completely
That's-
different.
I would totally agree, that requires, a completely a completely different set of circumstances. One is maybe an incidental that may happen once or twice a year, and the other
Right.
is an ongoing every day occurrence, or as often as people buy the product.
Well, there may be some avenues to limit the sale, like if you are selling at a farmer's market, it has to be, all food must be from an agricultural, because that covers your honey, your maple, and your uncut produce. Or a certified kitchen that, you know, Susie Homemaker can't make a pan of brownies and go sell them at the farmer's market. So there may be ways that we can limit what can be sold in a non-inspected kitchen.
Next is the bylaws.
Oh, just to at some point go through, because my understanding is some are,
Some are quite
Ancient.
antiquated.
yeah, and that we probably should start looking at them to see what needs to be brought up to current day, what things are obsolete, some
Right.
things might need to be changed, other things may be perfectly good the way they are, but even finding them can be a challenge in our
Okay.
office.
So if we start and we pull 3 a meeting.
Yeah.
Okay, so my recommendation, I don't know how everybody else feels, would be that that Lori could have 3 printed up for us for the next meeting. We take those home, we review them, we then come back, discuss them, make the changes at the next meeting, at which time you'll give us 3 more and kind of have an ongoing
No, that's
and
great.
go
Right.
through them.
So we're not.
So my question is, where in God's holy name do you actually find everything that's on the books? Cause I have a binder, it's just typed, but it's. Yeah, not exactly thorough.
No.
So I'm not sure if we actually have like written out bylaws that like go to the clerk's office or somewhere. I'm unclear of where they would go, but
Dennis,
I know
just,
there are some online.
there are some online, but they're not all online.
right, and
And
I'm-
there's that binder is very antiquated, like
Yeah,
it
yeah.
looks like typewriter on paper, like antiquated.
Yeah, and I have a question. If we have bylaws, and I'm not sure that's quite the right word, regulations.
Yeah.
Bylaws approved by town meeting, or regulations approved by this board.
okay, well, probably need to review all of them.
But if we have them and we're expecting people to follow them, we don't even know what they are.
Hence my concern.
That's-
That's
that's
why
what
I'm
I was
asking,
saying, let's get
because
them all.
It's kind of hard to hold somebody's feet to the fire. You didn't follow our bylaw we just filed yesterday for after.
And it was
Well,
just
I'm
back
also
of a
more
file.
concerned because I don't have a clear book of what we are supposed to be enforcing, so it's kind of hard to do my job if I don't know what the job is.
Yeah, so let's get that together, let's get it rolling, and if you wanna either pull the first three or. the
Okay, but
three
so
that you think
again,
of-
other than that binder and what few we have on the website, where else would I locate said things? Ask
I
Joe.
think Arthur would
Ask
know.
Joe.
Who's
Arthur.
been there the longest?
Joe and
Arthur or
Arthur.
Joe.
All right.
Dennis sometimes knows these answers too, that's why I asked.
Well, Dennis, if you have any great ideas, by all
When,
means.
They're probably, they are most likely in the binder. And-
Well, I have the binder and there's not a lot in it. That's
well,
my
then-
concern.
Then they may not exist
Well,
anymore.
then we
Okay.
can write it, but.
Yeah, okay, I just want to be clear on what we are expecting of people and
Mhm.
making sure, septic is in line with what it should be, that, my understanding is we only allow one system per plot. And with ADUs coming, we need to have that stuff really nailed down so that I don't have people coming saying, I have a system here, but oh, I'm gonna put a small one here for my ADU. It would be great if we had this stuff figured out prior to then waiting until it happens.
So why don't we start right there? on that
Okey
one?
dokey pokey. So
Okay.
septic will be the first thing we look at.
Uh-huh.
All right,
Excellent.
perfect.
Okay, we already talked about betterment loans. Oh, sorry, Dennis.
No, this is not on the agenda, so.
Can I
but
get
was-
going through the agenda
Yeah,
then? Okay.
I'll ask the question at the end and you determine how to handle it.
we got
Okay.
it. Okay, betterment loans, we've already talked about.
Yeah, I'm
Was
just
that
trying to apply for it and I'll let you know what I find out.
No problem, Country Club Way.
Oh, so this is a case of, if you look at the building, so I got this because it's building related and I am not signing off on it, because it says it has 4 bedrooms, but yet, there is 2 rooms that could conceivably be bedrooms, and I understand from a construction standpoint, it doesn't make sense, but from a, make a difference, but from a septic, it absolutely does. And when you're talking about 4 to 6 and Country Club Way, that's a huge difference. So my, and I told the engineer, because they're just doing what the people ask, they have no vested interest in this. I said, I'm gonna speak to you guys, and here is my suggestion. I would go back and say to the engineer, you can divide it for 5 bedrooms, 6 bedrooms, but whatever it's designed for is what we will put a deed restriction on the property that says it is a 5-bedroom home or a 6, whatever, however many bedrooms you want, so that when you sell it, it cannot be construed as, because we just went through this with another house that the realtor was trying to sell it as a 3 or 4, but it was really a 2 or 3. And that's what the assessors had, that's what the building department had. So if it's deeded on the, as a such and such number of bedroom, that takes the onus off of the town for approving a septic that it doesn't meet. So I'm just,
We have been,
have we done that before?
we have done deed restrictions.
Okay.
I tend to be a big proponent of them
Yeah,
when we have situations such as this.
I mean,
Because somebody might have 3 offices because they have these adult children living at home and everybody might be working from home.
right, but
you know.
generally offices don't have attached bathrooms. Full bathrooms. In general,
And
but, and again, the building code does not,
and the-
matter in terms of DEP and septic, so.
But I think that, when we get around to looking at that, we have to also understand that, The workplace is changing and, work from home is now much more common than ever before. I mean, where you, telecommute, I'm used to it. The future jobs, I think you're gonna see almost, half of them, if they're clerical or kind of administrative or office type things, they're gonna be work from home, so we have to make accommodations for that and make sure that our bylaws and our.
And that's
regulations-
fine, but
then-
when we
then a
need the
deed
house search.
restriction wouldn't affect.
No, I
Yeah.
totally agree. I'm just saying that we need to be flexible and understanding
Oh,
that reality.
Well,
is
that's what I
changing.
said, what I
Yeah.
said, Dennis, yeah,
Yeah.
I completely.
If you
agree
want
with
two
that.
offices, that's fine. I'll deed you as a 4-bedroom home, but understand when you sell the 4-bedroom home, it gets sold, you can't tell somebody that it's 6 bedrooms, because that's not what it's designed for. And
Exactly.
some poor buttiga that thinks that they're gonna get 6-bedroom home, and they're in there for 2 months and they overflow their SAS, and now they need a, $40,000 system. They're gonna be kind of mad, like, why was this not clearly stated what the house was designed for? I understand that people should do due diligence and pull reports and look at things, but that is not always what happens. So that's not uncommon, then you guys have done that before.
We have.
Okay.
We have a historical record, even from me being here, of deed restrictions. when,
Okay. All
you know,
right,
Because there are instances where you have things like that.
Yeah.
happen.
and given the location too with, you don't want to be ruining somebody else's property because your septic system is overflowing. Yeah, so, all right, that was it for that Country Club Way.
Looks like our next, oh, Dennis,
Yeah.
you had a something.
No, I've been, by word of mouth, been hearing some things, I will forget that. What's the status of, our, immigrants, refugees, whatever you want to.
Baymont.
There is no
Baymont.
status other than the
state
hotel is
does it.
full of people that are still in a shelter situation. That is, I literally have had, every once in a while we'll get complaints, housing complaints, but it's usually people who are being moved out. And when I call the shelter to converse with what I'm being told, I get the, history of what's going on. And, they send me reports of any pest control that's done there. I have not received any local, meaning people outside of the shelter, complaints about garbage or, refuse out there. I haven't had any of those in a really long time. So, nothing really to report. My understanding is the shelter is still full. It is not just filled with immigrants at this point. There are, US citizens in there as well. It is predominantly immigrants, but it is not solely immigrants. And that's really all I can tell you about the shelter. Does that answer your question?
It does. It sounds like it's, become an institutional limbo. Well, because
I have no end date.
No, because.
I don't suspect it's gonna end anytime soon.
Yeah, when the initial arrival, the understanding, or at least the understanding I had, was it was not a final destination, but.
A temporary stay,
A
yeah.
temporary thing, which has, I mean, when I was in the service, I used to live in temporary barracks, built 60 years before, they were still temporary barracks.
Right, well, my guess would be called the State Department, the, governor's office. That's all I can really.
Okay.
It's at a state level.
Yeah, and I have no, just so you know, I have no jurisdiction over it. I can answer a housing complaint. I can talk to somebody, but, sure, generally speaking, if you have me into your apartment, you're the one that's getting cited because you're the one causing a problem when you're not storing food away. So kind of like, I don't know a good citing, somebody that's living in a shelter is gonna do. It really becomes a matter of, the shelter staff working with that person, regardless of who it is, to make sure that they're complying with the rules of the shelter, which I can't do.
Yeah.
So,
And
Fun.
one other is, we talked earlier about, the business that has had, with suddenly the inability to comprehend English, has become an issue at a hearing. Where you mentioned that they were also going to be starting another business.
that's what we heard. today, that's,
Says
what-
rubber
What is the issue and authority for tobacco licenses?
that's a state, well, we license them. But, the state tobacco board is the one that does the compliance, there's like a agency that does the compliance.
That's why we're gonna address it when, if we actually see.
If
it
they,
comes to
if they put an
fruition.
application in for the,
Correct, then we address it
Yeah.
at that
Okay.
time,
But
otherwise.
it's
a
got
moot
nothing
point.
to do with tobacco, that's the issue, it's completely, there'd be no tobacco at this other business. But we have a long list of food establishment violations with all three sites of the other businesses. One had to be shut down because they had literally just opened and added equipment that was not on it, it wasn't there's a smoke and the whole 9 yards. The other two, we've had, I think, at least 5 re-inspections that things just did not get taken care of.
That
So,
was my next question.
I don't know what the answer is, but when I look back, there was a long-standing history of non-compliance and so,
Pure disregard for the
yeah,
town regulations.
so I don't know where
why
to
would
go
we
from
be in
here
favor
because
of
there's
that?
nothing I can do. I mean, we cite them, we fine them with the inspection fees. I don't even know if those are getting paid. Nope. So we, that's a couple $100 of outstanding fines by that business owner.
Yeah, so we have to address it when it comes to fruition,
Okay.
until
That
there's
was
a
done.
point.
Right.
There's.
I'm just putting it on your radar that
Yeah,
it will be a
Just
discussion.
sadden it, they may come up at a later time.
Yeah,
thank you.
just so people can have it in their brain and be
Yeah.
thinking about how you all want to handle it.
Anything else? Bill, you got anything, buddy?
So the guy couldn't speak English when he went to court, huh?
That's what he said.
That's what they did to me once at the Chinese restaurant. I brought a guy in from Boston.
Right, well,
We should have brought in video.
I don't know what to tell you.
Well, you did what you could do.
No, I'm going back.
No, I
I'm
said you
not
could do
letting
what
it,
you can do.
yeah, I'm not letting it drop. It's
And
a
that's the
waste of
same
an
people
hour.
you think they want to open up another place.
A positive, it's the same people. They came in and talked to us.
Oh,
Seriously.
Is a motion to adjourn in order? We don't know what to do.
Hold on, let's say next regular meeting is October 7th, 5 PM.
Yep.
Sounds like a
Good.
plan.
Okay,
Move to adjourn?
Second.
all in favor?
Aye.
Aye.
Lovely, thank you.